Today, on this World Day, dedicated to advancing understanding and action on regional anesthesia and pain management, we come together around a simple but powerful truth. Pain relief is not a luxury. It is a fundamental component of healthcare and of human dignity. Pain affects people around the world through the life course and across conditions, from cancer and cardiovascular disease to diabetes, trauma, and surgery. Yet for billions of people worldwide, particularly in the poorest communities, pain remains poorly recognized, inadequately treated, or entirely ignored. At the World Health Organization, we see pain management not as a narrow clinical issue, but as a major global public health challenge, closely linked to equity, health system capacity, and the growing burden of non-communicable diseases. Cancer illustrates this starkly. More than 20 million people are diagnosed each year, and many experience moderate to severe pain during their illness. While effective treatment exists, access remains profoundly unequal. In some of the poorest areas, people endure unnecessary suffering, not because pain cannot be treated, but because health systems lack trained personnel, essential medicines are inaccessible, and supportive policies do not exist. This inequity extends far beyond cancer. It's estimated that chronic pain affects in some regions roughly 1 in 5 adults and is a leading cause of disability globally. It undermines quality of life, it limits mobility, it disrupts mental health, it reduces economic productivity, and it places a heavy burden on families and caregivers. Untreated pain also erodes trust in health systems, and it deepens social and health inequalities. Thereby, addressing pain effectively requires strong, people-centered health systems, systems that are adequately financed and equipped to train health professionals, offer essential medicines, and safe technologies. And for this reason, pain medicine and pain management must be embedded within all countries' efforts to achieve universal health coverage through a primary health care. WHO promotes an evidence-based approach to pain management, ensuring access to effective treatment while prioritizing safety, rational use of medicines, and appropriate alternatives. This includes pharmacologic and non-pharmacologic approaches, psychosocial support as an example, rehabilitation, and palliative care. Capacity building is essential and is the way forward. Many countries face critical shortages of professionals trained in pain management and anesthesia. Education, workforce optimization, and integration of pain services into primary care and surgical systems are key to closing this gap. Within this context, regional anesthesia and pain medicine play an important role, contributing to safer surgery, better perioperative outcomes, reduced complications, faster recovery, and most importantly, improved experiences for those affected. On this World Day, we recognize the dedication of health professionals who work daily to reduce suffering and the importance of collaboration, innovation, and research to bridge this gap. But let it be clear, awareness is not enough. We must all do our part to invest in workforce, strengthen supply chains, integrate pain management into health strategies, and most importantly, for us all to listen to the voices of people who are living or experiencing pain. Because a world that tolerates untreated pain is a world that accepts unnecessary suffering. And together we must, and we can do better. Let us. Thank you.